Hi, I'm Dina Goldberg, a certified genetic counselor. Today, I'll briefly explain hereditary cancer risk and what it would mean for you and your family. Our bodies contain about 30,000 genes, some of which are called cancer genes. They work to protect our cells from becoming cancer. However, if these genes aren't working correctly, the risk of developing cancer increases. Although most cancers are sporadic, resulting from various factors like environmental exposures and lifestyle behaviors, we know that at least 10 to 15% of cancers are hereditary, meaning they're caused by a single gene change passed from parent to child. We can detect these gene changes with a simple genetic test. Genetic testing can be done with a blood or saliva sample. The results help us understand your cancer risk and find prevention strategies. They can also guide treatment plans for existing cancers and determine which family members are at risk as well. 3 results are possible from genetic testing. A pathogenic variant, or a mutation, means that a laboratory detected a known disease-causing version of a gene. If you receive a positive result, it typically influences your own medical plan. For example, you may be advised to start earlier and more frequent screenings, consider preventative medications, or sometimes opt for preventative surgeries. But remember, having a gene mutation doesn't mean you have cancer, or even that you will get cancer. It just means that your risk is higher. Knowing this information allows for more informed and proactive health planning. A positive result is also significant for your family. If you carry a mutation, then each of your children, siblings, and parents has a 50% chance of having the same mutation, so it's crucial that they get tested too. A negative result means that the laboratory found you had normal versions of all the genes your provider requested to be tested. If you do not have a mutation, you can't pass it on to your children. However, your siblings and parents could still have a mutation that you did not inherit. Genetic tests, like all medical tests, have limitations. Those with a strong cancer history but negative results may consider retesting as technology and knowledge evolves. A new screening plan may still be recommended based on family history information alone. A variant of unknown significance, or VUS, means that the lab found a less common version of a gene in you. Most of the time, these are harmless and normal. But until there's enough proof that the variant is normal, it's called a VUS. We usually don't act on VUS results because they're often reclassified as normal over time, so it's best to think of them like a negative result. But it's important to check in every few years, as more research might change how your VUS is classified. What about the cost? Most insurance plans cover genetic testing, and self-pay options usually cap at around $250. Various financial aid programs can further assist those who need it, so cost should never be a barrier to testing. Privacy and discrimination. Genetic test reports remain confidential unless you give explicit consent. Thanks to GINA, the Genetic Information Non-Discrimination Act, health insurers and employers cannot discriminate based on your genetic information, although this protection currently does not extend to life, disability, and long-term care insurance. For this reason, we recommend considering taking out a plan before you have a genetic test. You can learn more about GINA at ginahelp.org. Remember, having a gene mutation does not guarantee you'll develop cancer. It just signifies a higher risk, offering you and your healthcare team vital information to devise risk-lowering or preventative strategies. This information is incredibly important for the future health of both you and your family members.